Hey everyone, welcome. Today we are diving into something that is absolutely critical for your NCLEX prep, and more importantly, for keeping your future patients safe, the safe administration of blood. All right, so here's our game plan. We're going to walk through everything from the basics of compatibility to the high-stakes moment of recognizing a reaction and exactly what to do about it. Let's get into it. Okay, let's kick things off by putting you right in the middle of a situation you're definitely going to see, both on your exam and on the floor. So, picture this. You're 10 minutes in and your patient says this. What's your first move? What's your gut telling you to do? Just hang on to that thought. We're going to come back and break down the right answer at the very end. Now, to even know how to answer that question, we've got to go back to basics. The absolute foundation of all of this is mastering blood compatibility. This is the knowledge that stops a reaction before it even has a chance to start. Okay, so take a look at this. This right here is your cheat sheet for ABO compatibility. You have to know this stuff cold. A person with type A blood can get A or O. A person with type B can get B or O, and so on. Getting this wrong is, well, it's one of the fastest ways to cause a major, major problem. Now these are the VIPs of the blood world, and you'll see them on tests constantly. O negative is that amazing universal donor, perfect for emergencies when you don't have time to cross-match. And then you've got AB positive, the universal recipient, who can pretty much take blood from any ABO type. And it's not just about AB and O, right? There's another layer, the RH factor. The rule here is actually pretty simple. Negative patients should never get positive blood. I like to think of it like a one-way street. RH negative blood can go to an RH positive person, but you can't go the other way. A mismatch here is a big deal. Okay, now we get to the part that is all on you. This is the hands-on, high-stakes moment where your focus has to be absolute. The final checks you do right before you spike that bag. I really want you to let this quote sink in. This single phase, this moment of verification, is where safety is either locked in or completely lost. This is where the rubber meets the road. This isn't just a checklist, it's your final firewall. Notice it takes 2 nurses. You check the doctor's order, you confirm the patient's identity with another licensed professional, you ask the patient at the bedside to state their name, and you match every single detail on the bag to the forms. If anything, and I mean anything, doesn't match up, you stop, full stop, and you call the blood bank. And think of these as the laws of the land when it comes to blood. Normal saline is the only thing you hang with blood. You never, ever add meds to the bag. And you've got about 30 minutes to get that blood infusing once it's up on the floor. Oh, and you are the final quality control, so you've got to give that bag a good look for anything strange. All right, so we've talked about the blood itself. Now what about the gear you're going to use to give it? The equipment is just as important. This is one of those areas where a small mistake has huge consequences. Using the wrong pump or the wrong tubing can actually shred the red blood cells. That's called hemolysis, and that basically makes the whole transfusion useless. So always use the right stuff, and please never try to speed things up with a regular blood pressure cuff. And here's a perfect look at that special tubing we were just talking about. See that little chamber in the line? That's not just for show. That is a filter, and it's a critical safety feature. It's designed to catch any tiny clots or gunk that might be in the blood so they don't get into your patient. Now, what about blood warmers? These aren't for every transfusion, not by a long shot. They're really only for specific situations, like when you're giving a lot of blood really fast, and you can only use a device that's been officially approved for warming blood. And I know this might sound crazy, but please, please, please do not warm blood in a microwave or by dunking it in hot water. I promise you, it's in the textbooks for a reason. These methods will destroy the blood cells and can seriously harm your patient. Just don't do it. So, you've done everything right, the checks, the compatibility, the equipment, but things can still go wrong, and your ability to spot a reaction the second it starts is your next life-saving skill. You have got to know these signs like the back of your hand. Chills, back pain, hives, trouble breathing, and hey, look familiar? Apprehension and back pain, those are the exact symptoms from our question at the very beginning. They are huge red flags. But what if your patient can't tell you what's wrong? Maybe they're unconscious or intubated. Well, that's when you have to become a detective. You're looking for objective signs, changes in their pulse, their blood pressure, their temperature, or what their urine looks like. And this right here, this is why you never, ever leave the patient's side for those first 15 minutes. It is not the time to go catch up on charting. It is the most critical window for a severe reaction to happen, and you being there is their #1 safety net. So you see the signs. What do you do? Your response has to be like muscle memory, fast, precise, and always in the correct order. Burn this sequence into your brain. The #1 absolute first thing you do, stop the transfusion. Then you swap out the tubing and get a fresh line of normal saline going to keep that IV open. After that, you call for help, you stay with your patient, and you monitor them like a hawk. And there you have it. We've come full circle. That patient at the beginning, feeling apprehensive, complaining of back pain, those were classic signs of a transfusion reaction. The only correct first move was to hit stop, immediately. So, as you get ready to start your career, I want to leave you with this thought. That bag of blood is a powerful medicine, but it all comes down to vigilance. So, what's one habit you can build right now to make your final bedside check absolutely bulletproof every single time? Think about it, because that habit could save a life.